Hello, welcome to the Manual Handling Collective. I'm your host, Simone Hepburn. I'm a physio and manual handling educator, and I'm passionate about injury prevention. This is a podcast where I speak frankly with the brain's trust of manual handling and other amazing industry leaders in and around the occupational health and wellness community. You get to meet them, you get to be inspired, you get to learn from their stories, and you get to stay up to date with the latest and greatest in manual handling and wellness. So let's crack on. Dr. Shahina Braganza is with us today. She's a bit of a superhero. She is an emergency medicine physician who's been saving lives in Australia's second busiest emergency department at Gold Coast Health for the past 22 years. She's a speaker and educator, and on top of all her work, she's also a mother of two beautiful girls. If Shahina and her team can thrive all these years in the chaos of an emergency department, then we want to know what her survival secrets are. I first met Shahina back in 2015 when she was in a role as a director of what is junior doctor education, and she employed me as one of her medical education officers. So I know she's the real deal, and I know she actually walks her talk. So let's dive in. Welcome to the show.
Thanks, Simone. Thanks for that very generous introduction too.
I might be a bit gushing and stumbling over my words, Shahina, because you're also the most articulate person I know. So I'm a little nervous, but one of the things that you write is that good enough is the new perfect, right?
Absolutely. And I think, Simone, I think one of the things that I've acknowledged in recent times that I think it does take a little bit of evolution to get to that point. Mm-hmm. I'm now 46, and it's taken me probably till about 40 to accept that good enough is the new perfect. I sometimes need to just check myself, particularly when I'm doing stuff with my children, particularly academic stuff.
Like homeschooling in the coronavirus epidemic?
It's online learning is what it is, apparently. Online learning, but even normally when I sit next to them and they're doing an assignment or homework, and I sometimes have to check myself in terms of the expectations that I probably subconsciously, project onto them. Mm-hmm. And I'm humble enough to note that what I'm expressing to them is quite different from my good enough is the new perfect, because what I'm trying to impart upon them is that what I would love to see them aspire to, and to be internally driven to aspire to, is as good a job as they can do.
That's it.
So I think, to be fair, it's a message that really resonates with me now, but I'm mindful that it might not resonate if you are earlier in your personal life journey or if you're in your professional journey.
I have another question about perfectionism later. We'll see if we get time to dive in a bit more to that. But my first question is, can you share with us a bit about your journey into becoming a spokesperson for wellness? How did that all come about?
The journey, predictably, Simone, was quite accidental. My journey, I guess, first started when, as a second-year registrar, my first year here at the Gold Coast, after 10 months of working quite hard in what is actually the busiest emergency department in Australia.
Sorry. I read somewhere the second busiest. I didn't want to overstep.
Sure. Nonetheless, there are lots of busy emergency departments in Australia, and it is an environment where your resilience is put to the test on many.
I bet.
On many fronts. And after 10 months of working here, I found myself physically exhausted. And the physical exhaustion was something that I recognized quite readily. The emotional exhaustion was something that I did not recognize really at all until I pretty much tipped over in the space of, I'd say, 12 hours. Wow. It was my boss who rescued me at the time, and I'll always be grateful to David Green for being exactly the person that I needed him to be. And he listened, he empathized, and the most powerful thing that he said to me was, I've been where you are. And that was such a salve for my soul at the time. And before we parted that first meeting, he also said to me, I think one day you'll do something important with this. And of course, I had no frame for what he might have been suggesting, and probably neither did he. But I hope that 20, some 20 years down the line, I have I guess manifested that to some extent. So since then, the idea of wellness has been at the back of my mind. But my journey probably consolidated further, and I can talk about that more in a moment.
I was just going to add on another question. So you had that experience and that helped you focus on wellness. How do you approach or prepare younger career professionals or students whose life may have just been completely smooth sailing? How do you motivate them to really care about their well-being?
That's a great question, Simone, because I've heard it said that wellness doesn't become important to you, doesn't even enter your radar until yours is assaulted. So you're quite right that I think it's almost more challenging for graduates who enter their health professions, as you say, without having had their resilience all that tested. To prepare or to set themselves up for that experience that is distressing or presents more of a struggle. My modus operandi has really been to share my own stories because I don't actually have expertise or qualification in this field. All I've really got is my own experience and my own journey. That might be useful to some people. It may not be at all useful to others because my messages may not resonate with them, and I fully accept that. But I found that expressing where I've had my own struggles, barriers, difficult times, and then talking about what helped me is probably, for me, has felt like the most honest way to impart the message.
And I guess through those stories, you're giving them also that permission to struggle, that if it happens to them, it's okay.
I think that's probably the most important thing that I hope that I am imparting, that permission to struggle. I think in many professions, particularly in healthcare professions, there is this sense that struggle is not really, an acceptable experience almost, that it's a sign of weakness or a sign of failure. And as a result, we tend not to share our stories. And sadly, as a result of that, I think we perpetuate the difficult experiences that people have. I think when you are isolated in that experience, it really amplifies what's negative about it. And once you start sharing that experience, it normalizes it and it dilutes the struggle to some extent.
Great. Well, that's a good segue into my next question about isolation and struggling in isolation. We're now a few months into our COVID-19 healthcare crisis. A couple of questions. Firstly, you're at the front line. What's the general mood and vibe amongst emergency department staff now that we're a few months into this epidemic? And then can we talk about your involvement and the COVID-19 personal wellbeing plan that you've helped with?
Sure. So let me tell you about the evolution of the mood, because it's been strange times on many fronts for many people, professionally and personally. I think at the initial phase of the pandemic, when we were preparing for, significant challenge, we were preparing for a 300% increase in the demand on our healthcare service. And so for those first probably 3 weeks, I would say, there was a lot of anticipation, a lot of apprehension, a lot of fear and anxiety. But something that I was, struck by was that in addition to that fear and anxiety, there was just a very silent but powerful sense of purpose. People relinquished leave, they relinquished non-clinical time. And it was palpable to me that people just were willing to just front up and to serve. And in my career, I don't think that I've experienced that to that extent before. So I think that the struggle was mitigated a little bit by this sense of fulfillment and purpose that people had. Um, Nonetheless, we did what we could to prepare as best we could. And one of the big priorities for us was to keep ourselves safe, so that we could sustain ourselves into whatever might evolve.
Mm-hmm.
And so we had a lot of energy around training with personal protective equipment. There was a lot of logistical work and operational work around uh, rejigging our emergency departments so that patients would be safe and so that staff would be safe as well. I feel confident that the plans exist should the pandemic evolve in a different direction to where it's going now. And back in the clinical front, we are seeing an increase in our patient presentations again, back towards what we'd normally see at this time of year. In answer to your question, what has the mood been like? I think there probably is a little bit of fatigue. We've spent a lot of time anticipating the pandemic, planning for it. We've continued to front up to work, regardless of what the demand has been. And now we're seeing that increase back to normal numbers. And I acknowledge that we're a cohort of staff that relinquished leave. So we did not take the leave that we were meant to take. And so I'm just mindful that we're probably entering a phase where we're running a bit low on our energy and our reserves.
A little.
Part of your, sorry, go ahead.
I just thought of a little side question. Did you ever get to meet Tom Hanks?
I like to joke that yes, of course. He and Rita walked through the emergency department and were signing autographs. But no, the short answer is no, we didn't.
Very good. And the second part of the question is a little bit about your alliance with your international collaboration in Rappam. Do you want to tell us a little bit about that and the COVID personal wellbeing plan?
Yes, I would love to. So RAPEM stands for Wellness, Resilience and Performance in emergency medicine. Unfortunately, the word RAP was already trademarked. So we had to make it RAPEM. We would have loved for the name to have been much more inclusive of everyone who works in healthcare. But we're hoping that some of what we've built that may be emergency medicine focused is translatable, not just to other disciplines within medicine, but in other healthcare professions as well.
I'll put the link to the Rappam website in the show notes because I had a really good look around there and there's so many great resources that I thought definitely translated across other professions. So I think people should check that out.
We'd really appreciate that. We are a collaborative of emergency medicine physicians, nurses and educators. But together we organically coalesced into this working group of people that had similar interests and had a real passion for promoting wellness in medicine and in healthcare. We wanted to marry the idea of wellness with performance for a number of reasons. Because I think it's increasingly, there's an increasing evidence base that links wellness with performance. But secondly, we found in the groups that we work with that if you talk about performance, that can sometimes be the conduit for people that might be a bit skeptical or cynical about entering a wellness conversation, that the performance frame might be something a bit more accessible and acceptable to them.
Yeah, I like that.
We formed about 2 years ago, and really, we kind of create stuff for ourselves and for our departments, and then we share it on the RAPEM platform. Like I said, to see what might be useful to other people as well. Every year we hold a wellness week, and this year all of our excellent, well thought out plans for Wellness Week had to be
landed right in March 2020.
Absolutely, and had to be rapidly modified to accommodate the fact that COVID had shifted the frames for everyone. But as emergency medicine workers, we're nothing if not adaptable and responsive. I must acknowledge the work of one of my colleagues, Ashwini Amaratunga, who was the main driver for formulating this personal well-being plan. And really, it was just designed to be a toolkit to nudge people into thinking about the elements of self-care at all times, but particularly during COVID. And if your listeners hop onto the website and look at that wellbeing plan, it's intended to be something just quite simple, um, with ideas that should be accessible to most people in terms of, the aspects of how do you go about just paying attention to looking after yourself.
I like that there's there's a space for you to fill in some ideas of your own around acknowledging your discomfort, the what, the who, the when, the where, the how, and some activities. So you give yourself a self-care plan, a mental well-being plan, how you're going to filter information, and then there's a bit about safety, social distancing, and decontaminating yourself when you get home.
Yeah,
Lovely.
one of the many things we've learned is that there's no one size fits all for people. And so I think these questions invite some reflection on um, how things work in your own head, and hopefully bring awareness to, what are some of the unique, traits or attributes that you might possess, and then what are some of the strategies that you might employ that are actually accessible to you in order to address them.
So that link between wellness and performance is such a great one to make and to reach out to people. And I think a lot of my listeners, are very familiar with manual handling type injuries and musculoskeletal type injuries. And they know that there's this growing body of evidence how work-related psychosocial hazards can increase your risk for a musculoskeletal disorder as well as a mental health disorder. So on the Rappam page, I also saw a really neat mind map of the psychosocial risk factors in the emergency department. And I thought the words and the language that was used there was really interesting because it's not typical of what we'd see in a workplace health and safety language, but I think it's really relevant and would really resonate with people. Can you talk us through that mind map a little bit as well?
Yes, sure. I'll just double check that we're talking about the infographic.
Yes, that one.
With the patient care at the center.
Yeah.
And again, I'll acknowledge another one of my colleagues, Melanie Rule, who works in Brisbane as an emergency physician as well. And Mel created this infographic as a result of conversations that we've had in RAP-EM over a period of time. Our focus for Wellness Week this year was designed to be around how wellness links to patient care in the workplace setting. So it was important to us that patient care remains at the core of any activity that we might have in this space. But as you said, Simone, I think physical hazards in the workplace are very visible to us, obviously, but those psychological hazards are almost invisible, I would say, at times, not just by the nature of them, but also by their chronology. Many of those injuries can be sustained over long periods of time. It might not be one discrete episode, but it can often be an accumulation of psychological insults over a period of time. And that means that sometimes the injury or the impact upon a given person can be quite insidious. If you hurt your back with manual handling, or if you incur a needle stick injury, it's very apparent, it's acute, and it's relatively clear what needs to be done to fix it. But if you're incurring psychological injury over a period of time, I think this, exactly like my story at the beginning, sometimes it's a cumulative impact, which then it almost seems like something trivial can just tip a person over the edge. But it's actually years of
and they're so interwoven, the physical and the mental. It's hard to separate. And I think if we're in my industry and injury prevention, if we're serious about trying to further reduce musculoskeletal injury rates, we need to have more conversations like this about these secondary psychosocial risk factors. Things like,
I'm really intrigued to hear that statement that you made, Simone, about the direct link between
yeah.
psychological and physical injury.
I'm going to put there's a recent 2019 article that I'm going to pop in the show notes as well that demonstrates that. But words like emotional contagion and civility, sustainable rosters, things like that, I think should be more in the conversation.
Yeah. I'll also draw your attention also on the Rappam website. We have another infographic which is titled Synergistic Wellness. And I'll send you the direct link to that, Simone. But it talks about how there's really three facets to wellness in the workplace. There's individual, there's departmental, and then there's organizational. And the reason that we found that there's value in separating, these ideas out into these three facets is that it's easy to blur what is an individual issue, such as resilience, or even mental illness or other psychological traits, even personality, to what are operational issues like even interprofessional, interactions, but even rostering, access to leave, etc. And some of the people who speak against having an overt wellness agenda in the workplace, very legitimately talk about how we can't be expected to contend with heavy workloads or untenable rostering just by increasing our resilience. And so we found it very useful to separate out those challenges because then it helps you to separate out what the strategies are for addressing them as well. And so you brought up emotional contagion and civility. And to me, that kind of belongs in the department uh, part of that Venn diagram that we've drawn. It's how individuals interact with each other. It talks about how the mood and the tone with which you arrive in the workplace significantly affects the tone around you. And I really like this idea of being able to develop a skill whereby you can separate how you feel from how you behave. And this is demonstrated to me at a very personal level, week in, week out. Just last week, I arrived at work. For various reasons, I was just feeling a bit tired and a little bit beaten, I must say. And I trudged into work at 7:25. It was a dreary day, and I reflected on how the sky kind of reflected my mood. I arrived to work, and as I was walking down the corridor to put my lunch away, I saw one of our portrait staff, and I called out, "Good morning, Gary." And I was really, taken aback by how cheerful my voice sounded because it was an absolute betrayal of how I was actually feeling inside. But of course, Gary called out, "Oh, good morning, Shahina. Nice to see you." Um, and the fact that he'd given me this cheery response really buoyed my spirits. And I thought, it was a real powerful illustration for myself. As recently as last week, you might think that I'm an expert and I've got all of this down pat. But as recently as last week, I was reminded that, if you sometimes even just fake it till you make it, that can not only have a positive impact on other people, but it can easily just feed back on you and think, actually, I'm probably not as morose as I have convinced myself that I'm feeling.
Yeah, I like that. So yeah, the Rappam website is the place to go for some of these awesome resources. There was something else that we talked about before the show started about pandemic kindness, which is something that you're passionate about. Do you want to share a little bit about that?
Thanks, Simone, for the opportunity to talk about that. Pandemic kindness movement, and I'll share with you the link as well, is the work of a collaborative of various clinicians and other people, mostly on the Eastern Seaboard. It was initiated by a pediatrician called Jane Munro down in Melbourne. And she just tweeted something on social media, again, about 2.5 months ago, about how this was, the time was ripe for us as a group of health workers to, I think, create something tangible to sustain our colleagues through the pandemic. And the one part of this that I'll highlight for you is that, we came up with this framework that is based on Maslow's hierarchy of needs. So for those people that may not be familiar with it, it's basically a psychological construct on the priorities that we have as human beings. So at the base of the pyramid is a layer called safety. And this is about things like, shelter, food, uh, basic needs. Sorry, it's not safety, it's basic needs. The layer above that is safety. So the idea is that once you've established your basic needs like food, shelter, sleep, etc., then we can kind of, again, as humans and as a society, draw our attention more to safety needs. And with safety, we can think about physical safety and psychological safety, as we've touched on already. And then once we've kind of sorted that, we can then turn our attention to esteem, or the sense of love and belonging, and what it is to be part of a community, what it is to be contributing to something. And the next layer above that is esteem, and all of the things that bring us um, a sense of value, and a sense that we're contributing to something larger. And then the final sort of peak of the pyramid is called self-actualization, but it's really about the stuff that brings us meaning and purpose. And we found that this framework was useful when we thought about what is it that our colleagues and we ourselves that are working in healthcare at this time need in order to sustain us. And so, under each of those categories, we were able to find some resources, just a small amount of carefully selected resources that people working in health could access
Good one.
if they were looking for things under those certain areas.
I like it. I will definitely check that out. The pandemic kindness movement. Sounds fabulous.
So having established the website, our next goal is to, focus our attention more on tangible stuff that we can start doing. There've been ideas like, we know that during the pandemic, blood bank donations decreased for various reasons. And so that's a priority that we would like to take on as a movement and try and galvanize people who work in healthcare and our communities at large to go out and
back to
donate blood if
donating.
they can.
Excellent. So bringing it back around to your backyard and things that are tangible in your emergency department, what sort of things do you do with your group of doctors and your staff to bring that wellness into the workplace? I'm hinting at your 1ED program.
It is challenging. And it's challenging for various reasons, and hopefully, many of your listeners can relate to this. It's challenging because we don't get much opportunity at work to pause and pay attention to our wellness. If we do, it's seldom in a group setting where we can do stuff together. As I mentioned before, some people just have an innate skepticism around any kind of wellness agenda on the work front. And sometimes we're so buried in our work that it's hard to step back or step above and really have a look at not only how we can do things better, but how we can be better and how we can feel better. So having started with those challenges, our 1ED program has been running for probably about 4 years now. And there are different aspects to it, but I think, there's some structured components and then some non-structured components. Of the structured components, the one that I have found to be most impactful is the fact that we conduct a 4-minute pause every Thursday morning at our handover at both campuses, Gold Coast Uni Hospital and Robina. And during that pause, we do various things. And so firstly, there's about 40 people who attend that pause, our night shift and our early shift, mostly medical, but also some allied health professionals, sometimes some senior nursing as well. And so we have, somewhat of a captive audience, even if a proportion of them are tired post-night shift. But during that 4 minutes, we might watch a wellness-related video, or someone might make a commentary on the kinds of things that they find challenging during their shift and what they do to contend with that. Or we might even do a guided meditation together. What I've learned over the 4 years is that what we do in that pause is somewhat important, and the message imparted is somewhat important. But I think what's more important than that is the fact that we've paused at all, and that we've acknowledged the fact that what we do is unique, and that it can have different impacts on us at different times, um, and that we've just taken the time to pay attention to ourselves. And often I find that the value of the pause is not in the imparting of the message, but sometimes the exchanges that happen afterwards, later that day or later that week, or even sometimes a month later. Someone will come up to me and say, oh, that commentary that was made by a certain person, that really resonated with me. I've had a similar experience. I have found that gardening, for instance, which was the message on that occasion, gardening for me also helped me get out of my rut.
Yeah.
And it was just really nice to hear that someone else had had that same experience.
And I would imagine with, 40 doctors in the room, there'd also be just that sense of connection, that we're all in this together, we're all here, just that physical being in one space connects you for a moment.
I feel so, Simone. And the more I kind of delve into this area, the more I feel that it's exactly that you mentioned, connection, that becomes the lowest common denominator for everything, whether it's emotional contagion or civility, like you talked about before, or sharing our stories, or even if we leap to that performance agenda. And in emergency medicine, all of our work is teamwork. But if we can connect with each other psychologically, then we connect with each other cognitively as well, in terms of having a shared vision, whether it's our global outlook for what we want our emergency department to look like, or whether it's in that hyperacute setting of the resus room, that we have a shared vision that we need to get this patient safely to theatre as soon as possible. I love that idea of connection, because I think to me it's the core and the base foundation for all of this.
My next question, I'm just looking at the time. I've got so many things I want to talk to you about. Emotional intelligence is the one. We all know people who don't seem to have it, like the office hothead who doesn't seem to be able to manage their emotions, or the people that can't read social cues and can't read the room. But you seem to have it in bucket loads, Shahina. So my question is, do you think emotional intelligence is something that you're born with, or is it something that people can learn? And if you think you can learn it, how might people start to practice or build their emotional intelligence? What might that look like?
Sure. I hope I'll remember to end with a quirky story about how I also felt that I had, a good amount of emotional intelligence, but just very recently I messed something up. But in answer to your question, are we born with it or can we learn it? I think both. I think that when I say born with it, I think probably your early childhood experience is very important in terms of what gets hardwired into your brain, with respect to probably two aspects. Again, how you connect with people, but also, that sense of self-awareness, which I think is probably at the core of emotional intelligence. Taking that time to really think about, how do I think? How do I feel? How do I tend to respond to situations? And then taking that step further of, when I respond in this way, what is the impact that I have on other people versus when I respond in this other way? For example, your office hothead. I've had times when I've been a hothead, but I'd like to think that perhaps what I've done differently is that I've taken the time to think, I behave like a hothead then.
Today, yeah.
This is the impact that it had on other people, and this is what happened consequently. Was that a functional outcome, or was it a bit of a dysfunctional outcome? And how can I modify that in the future, while still maintaining some kind of kindness and compassion for myself, and allowing myself to be human? Um, and I think that's part of the answer to how do we then develop it. And I think one of the, hopefully, simplest, not easy, but simplest ways to develop it is to take a few minutes out on a regular basis, maybe even when you're driving home from work each time, or showering, just to think about maybe one, interaction that occurred in that day, whether it was an effective one or an ineffective one, what made it effective, what made it ineffective, and then think about how you can do what works more often. And again, I think this sometimes takes a little bit of faking it till you make it. Um, it takes emotional regulation. It takes separating how you feel from how you behave. But hopefully, over time, paying attention to it reinforces what works, better than other approaches. My story of humility and vulnerability, which are my signature, are that thank you. I think for the most part, I pay attention to um, the tone of what I'm communicating. But I discovered yesterday, actually, that the tone of something that I had communicated um, had not been received in the manner in which I intended it. And when I look back on what I communicated, I do take responsibility for at least part of my, of my piece in that. Um, I can justify it to the nth degree, and I can justify it all I want. But at the end of the day, the relationships that I have with people at work are really important to me. And so I'm kind of working through the feeling of being injured by the feedback that was given to me, and evolving to a place of maturity where I can take the lessons learned, um, and hopefully leverage them.
Very good. So taking some time to reflect, I like that. One interaction a day, reflect on that, and then what worked, what didn't work. I think that's achievable for us mere mortals who are
and I would encourage us to take the whole spectrum, not just take the poor interactions, so we can beat
take
ourselves
some good
up.
ones.
Take the good ones as well, and also where there've been poor interactions, again, exercise that kindness and compassion, that acknowledgement that we are human, that we're allowed to get things wrong sometimes, because as long as we're getting things wrong, then that means that we're still learning.
I have
Growing.
I work with the first and second year medical students at our local university, and it's hilarious that when we talk about emotional intelligence there, or talk about communication or time management, they say, oh yeah, we've done this, we know this, we've got this. But as you know, it evolves over time and many years of practice. So I will be passing on your advice to them.
Sure. And we know, Simone, that knowing is very different from doing. And also doing in different circumstances is very different, because it's easy to do the stuff when it's easy. It's the doing it when it gets challenging. And again, I was really challenged by my exchange yesterday. And it's, I've really reflected a lot over the last 12 hours over purpose and what's important to me, and values, and trying to slow down and allow those bigger themes to inform what I do with this experience.
Yeah, that's good. I have to say, every now and again when I get caught in a tricky situation like that, I think, what would Shahina do in this situation? Because you're definitely the opposite of the office hothead.
Thanks, Simone. I'm in a state of mind where I will graciously and gratefully accept that.
Very good. One of your posts that I read said you don't need a title to be a leader. And can you talk a little bit about managing up? Maybe have you got some examples for people about being a leader in their own position?
Yeah, I've been incredibly fortunate to have had leaders with titles in my emergency department who've been a massive part of my development, not just professionally, but personally. But alongside those leaders are other people that I work with. And the two that come to mind are Patrina, our emergency department admin officer, who sits at the front desk and puts a smile on my face every time I walk past her. Again, no matter what kind of frame I have arrived in. And I've reflected on, why is it that Patrina makes me feel like this? And I guess if I try and deconstruct it, it's because probably regardless of how she's feeling when she arrives at work, she's determined to put a smile on her face and greet everyone who walks through that front door with that smile, with a warm welcome, with a sense of imparting the fact that they have value and that they're important, and she's at the ready to help them, with whatever it is they've walked through the door with. Turns out that her desk space is also incredibly colorful. She's got a whole heaps of fundraising chocolates on the front counter at any given time. So, all of that just promotes that vibe of color and happiness. And another person you might have read in a blog post, if I've written one around this, is Gary, the same Gary that elevated my mood the other day.
I think I know Gary.
You probably know Gary because he's been there longer than I have. But Gary just gets things done, and he's head of Portridge in the emergency department, but works very much actively alongside his team. And I know that if I'm in the resus room and something needs to happen, I almost feel sometimes like Gary's decided the patient needs to go to CT before I have, because he's
got the bed ready
on the transfer monitor. He's got the bed ready. He's got the oxygen cylinder ready before I've even articulated that that's what we're going to do next. And similarly, I've worked alongside interns who have inspired me with the professionalism, the conscientiousness. They come, really at the base of the pyramid in terms of their clinical knowledge and their technical skill, but a lot of them come with such a deep sense of the value that they place on even punctuality, of showing up, of working hard, of being accommodating, of being obliging, of being respectful. And I encourage them not to underestimate the influence that has on the team around that in real time.
Yeah, definitely. There's always an energy exchange, isn't there, between people in your environment, and there's some really good examples of how those people can influence.
And it's that emotional contagion again.
Excellent. So what is next for Shahina? I saw on the Rappam website there's an event that you're doing, Wellbeing and Performance Optimization. That looks super interesting. I've never seen a program like that for doctors. Can you tell us a little bit about some of the things that you're doing?
So I'm very excited that you're excited by that. We have actually just had to postpone that event to March next year due to COVID. And again, I'll give a shout out to another one of my colleagues on Rappam, Bethany Bolton, who's our pocket rocket, who alongside others has put together this workshop and the program for it. As you've alluded to, I think putting a program together like this takes courage because it's a conference that is just overtly, nakedly, unapologetically about wellness and performance without being a part of a conference, for example. And really, it's an invitation to people to come and immerse themselves for a couple of days in the kinds of themes that we've just been talking about, and to explore each other's ideas, to share ideas, and to talk about, I guess, priorities and values in the space, but also to look at what some of the barriers are for people and within the workplace, and then come up with some strategies to how we can make some small steps in a positive direction.
It looks like a cross between a conference and a wellness retreat.
So between us, I'm really selfishly pleased that it's been postponed, because I had a conflicting commitment on the original dates, but now I can prioritize it for March of next year.
And is that program aimed at emergency doctors, or is it health professionals? Who's your audience that you're...
It is aimed at all health professionals. It is our first foray into this. We felt that we were being quite ambitious when we conceived of it, but the response to it has been, heartwarming and encouraging. Probably our rate determining step is going to be the capacity at the venue for people, and also being mindful that, a certain group size will be more conducive to certain conversations. But yes, we're welcoming everyone who works in healthcare.
You should check out the program on the website. From my memory, I remember mindfulness, meditation and cooking, which sounds like very relaxing weekend.
Yeah, absolutely. And I think, the key is to try and incorporate and embed whatever is your wellness
strategy
tool or strategy into your everyday life or your everyday practice. Because the last thing that busy healthcare workers need is one more thing to get done and one more thing to feel guilty about. So the better we can just kind of incorporate this into, our activities on a day-to-day basis, then the better we will be at sustaining it.
Excellent. Lastly, any final messages, things that you think we need to change into the future to help reduce, this workers' mental burnout or overload? Any bits of advice to share?
Yeah, sure. And I've probably got 2 related responses to that. And that is, I think, to just be open-minded and open-hearted about how this is an absolute work in progress. At a very personal level, I've shared with you a story about how, I've struggled with something within the last 24 hours. And it's made me re-examine my approaches and what I espouse to be strategies, and to really think about, do those strategies actually apply all the time, or do they only apply in certain contexts? And globally, in terms of future direction, I think, COVID has been confronting, but at the same time, there's been a real silver lining to it, in that it's brought healthcare worker wellness front of mind for us at individual level, department level, but at organizational level as well. We haven't fixed anything. We're probably never really going to fix anything. But I think as long as we're having these conversations, giving people permission to experience what they experience, working to normalize these conversations, and helping people to not feel isolated. As long as we're doing that, then we're moving in the right direction. And I think that's all we can ask of ourselves.
Very good. So I mentioned a couple of links I'm putting in the show notes, but how can people find out more about you or get in touch?
Sure, thank you. In addition to the Rappam and Pandemic Kindness movement, I have a much neglected blog site, which is shahinabraganza.com.
I wouldn't say it's much neglected. I thought it was amazing. That I like the, it asks you, do you want to read, listen or watch Shahina? And you can choose from, blogs, podcasts, articles.
Thank you very much. Good. I feel very sheepish about how it's potentially kind of all about Shahina, and a little bit self-indulgent. In a way, it's my kind of personal filing cabinet for the stuff that I come up with. But people are most welcome to explore that and see if there's anything useful for them. And you can get in touch with me via the website as well. I love having these kinds of conversations with people, and I love contributing wherever I can.
Excellent. Well, I think we're out of time, and I just want to say thank you so much today, Shahina, and we'll catch up soon.
Thank you, Simone. Apart from the opportunity to share these ideas, I kind of feel like it's been a bit therapeutic for me as well. So I really appreciate that. Thank you.
You have been listening to Dr. Shahina Braganza, and you can see why. She's a genuine trailblazer for workplace wellness. I especially liked how she links wellness to performance for any skeptics out there. There's definitely something in that episode for everyone, from an individual perspective, relating to your team or your organisation. To me, Shahina's like an Aussie Brené Brown in a white coat. She definitely inspires through her humble stories of courageous vulnerability. I think in manual handling, if we're serious about reducing the risk of musculoskeletal disorders, we need to have more conversations like this about the impacts of psychosocial risk factors. More people should get to hear Shahina, so please share this episode with anyone who you think might need a little bit of Shahina wellness and optimism in their lives. You have been listening to the Manual Handling Collective podcast. If you're only listening through audio, we've also filmed this episode. If you want to see a little extra, see the link in the show notes. Subscribe to stay notified of future episodes, like, share, comment, and get in touch to hear more of what you want. If you know a guest who'd be a great fit for the show, just let me know.